Lees-Galloway.
Thank you very much, Mr Speaker. Well, can I start by allaying Dr Hutchison's fears about the opposition's support? Let me be quite clear that we will support this bill through to the Committee of the Whole House, although we do look forward to that opportunity to offer some amendments to the bill. As has been described by the speakers so far, the bill sets out to establish the Health Quality and Safety Commission and also to introduce a mandate for collective purchasing across DHBs and also to arbitrate where DHBs have conflicts over shared services. This is in an effort to share procurement opportunities, to reduce costs and to reduce bureaucracy in the health system, all of which are noble objectives and which the opposition supports. But let's dispel a few myths, Mr Speaker. Collaboration in the health sector and in the health system is not a new thing, as the previous speaker would have had us believe. In my own part of the world, in Palmerston North, the Mid-Central District Health Board and the Whanganui District Health Board have been working together for some time and currently have an alliance in place where they are looking to share more and more services. That came into place, or that sharing of services and that collaborative approach came into effect long before the election of the current government. Same can be said of the entire Lower North Island region, in fact, where the whole region, the district health boards from Hutt Valley, from Capital and Coast, from Wairarapa, Hawke's Bay, Whanganui, as well as Mid-Central, have been working together on a regional basis and collaborating in that way. So, yes, both sides of the House support it, and yes, previous governments have supported this approach. It's not a new thing. It's not some wondrous new invention created by the current national government. Let's also talk about the concern that many people in the public have and the great concern this government seems to have with cost blowouts in the health sector. First of all, I would like to draw to the attention of the House exactly where New Zealand ranks internationally in costs per capita. Total health costs, both public and private spending per capita. In New Zealand in 2008, the OECD estimated, this is in US dollar purchasing power parity terms, the OECD estimated that New Zealand spends $2,683 per person. That compares to Australia at $3,353, Canada at $3,867, the UK at $2,990 and the US at $7,538. So New Zealand actually ranks extremely well against other countries that we'd like to compare ourselves with. So when we're talking about exactly what healthcare costs in New Zealand, let's be honest. It is important that we try to find more efficiencies, that we try to reduce bureaucracy and we try to make our dollar stretch that much further. But let's start off with an honest conversation about what is actually happening in this country. Growth in spending, and yes, there has been growth both per capita and as a proportion of DHB over the last decade, as there has been in all other Western countries. Everybody's facing this challenge. The growth in New Zealand has been fairly steady, and Dr Hutchison mentioned a rate of over 8%. Well, actually, if you look at the OECD figures, we've never reached over 8%. The most recent was at about 6%, and that hasn't been steady at 6% over each year either. It has been a lot less than that. And so, whilst we support this bill, there are some underlying myths being espoused by the government as to why this is so important, and it is important that we explore some of those. And New Zealand does very well. The reason why we do well is because of the structure that we have in place, because we do have a publicly funded health system, because we can actually have single purchases, because we can have collaboration between providers, and that helps them to reduce costs. A very good structure that is a very good example of this is, of course, Pharmac. where we get fantastic reductions in comparison to, say, the US system, because we have a collaborative approach to purchasing. So it is good news to hear from the Minister that he doesn't want to see a massive upheaval in the health system, and the opposition will be watching very carefully to make sure the Minister sticks to his word on that, because we have had a lot of upheaval over the years, and we do need a stable system, and upheaval by stealth will be uncovered by the opposition, and we will hold the government accountable if they attempt to do that, because we have a good system and we need to maintain it. Mr. Speaker, the real cost savings in our health system are to be found in a proper, realistic and substantial approach to public health. But unfortunately, this government seems to have eschewed public health, put it to one side. In fact, this piece of legislation, it's fantastic that we're actually debating a health bill in the House. However, there is another one which has been languishing on the order paper for ages, and that is the public health bill, which when this term of Parliament started was actually quite close to the top of the order paper, and has just been buried further and further and further down, because public health is not a priority issue for this government, probably because there aren't too many sound bites in it. It's a little bit hard to sell, and I don't think Crosby Textor have actually come up with any good sound bites for it. But that is where, Mr. Speaker, that is where the real savings in healthcare are to be found. A proper long-term approach to diabetes, to cardiovascular disease, to reducing smoking-related disease, alcohol and drug-related disease, and in fact also focusing on mental health as well. It is a focus on well-being. It is a focus on keeping our people well and keeping them out of the hospital, not waiting until they end up in the hospital and all the costs that are associated with this. But it's too big for this government. It's too forward-thinking. It's too far off in the future. They're not worried about the well-being of our country in 20 years' time. They are worried about next year's election. Let's be honest. And in fact, the other thing that we could be doing to improve the health and well-being of our nation is to reduce income disparity. There is an absolutely clear link between income disparity and low socioeconomic status and poor health outcomes. What has this government done? It's increased those disparities by giving tax cuts to the very well-off, those who need them the least, and increasing GST, which affects those who have the least the most, thereby increasing those disparities and giving our nation a larger health bill in the long run further down the track. Mr. Speaker, in the Health Select Committee's report, it is noted that some members, i.e. the opposition members, have some concerns about the removal of the requirement of DHBs to consult with the public. Mr. Speaker, we have nothing to fear from consultation with the public in this country. We have a very strong Parliament, we have very strong public institutions, we have very strong DHBs that are able to progress their policy initiatives and their strategies and their plans, and they are able to roll those out. There is nothing to fear, there is nothing to slow us down from having proper public consultation. All that we can achieve, the thing that public consultation will achieve, is better policy making, better strategies that actually respond to what our local communities need. And this did come up time and time again from a number of the submitters. The Women's Health Action Trust, I think, actually summed it up quite well. They said that consultation with communities should not be viewed as a nicety, but rather as a fundamental part of the public health and disability system that ensures health and disability services are appropriate for and responsive to those who need them. I couldn't agree more, Mr. Speaker, and the erosion of that consultation process erodes the ability of not only the public at large, but also those non-government organisations and the clinicians, which we hear so much from the government, their concern that clinical leadership has been eroded from the health system. Well, those clinicians, they are having their say eroded as well by this removal of the requirement for the DHBs to consult with the public. The New Zealand Nurses Organisation actually brought up the issue of nursing leadership down in the southern DHB, and they said as the amalgamation occurs between the two DHBs down there, they have seen an erosion of nursing leadership. Mr Speaker, we will support this bill. We support the aims and objectives. We look forward to the Committee of the Whole House, but let's just have an honest debate about public health care in New Zealand.